Great. Thank you guys for joining us. We're going to go ahead and get started to keep us on time. My name is Bhargavi Chakuri. I'm a family physician at the University of Colorado, and I co-direct the Diploma in Climate Medicine at the School of Medicine. We have a great panel today. We are going to be talking about how to really leverage medical education as a form of climate action. And we're going to be talking to you about a little bit about why doctors and nurses and other health professionals are here at COP27. And we have an excellent panel of students as well as faculty to really talk about how partnership in this space is really needed. So, sorry, we're just making sure someone's had a fall, making sure they're all right. It looks like they are. And so I'm gonna introduce the rest of our panel. So sitting next to me is Terry O'Connor. He's an emergency medicine physician, and he is also faculty at the University of Colorado with me, and my partner in crime is my co-director of the Diploma in Climate Medicine. And next we have Carly Hampshire, who is one of my climate heroes and a fourth-year medical student at the University of Colorado, University of California, San Francisco, though we wish she was with us. And also the founder of the Planetary Health Report Card, which has been a game changer in medical education and planetary health education. Virtually, we have a few participants. So we have Anandita Patnaik, who is a medical doctor and has a MPH from the London School of Tropical Medicine and Hygiene. She is the regional lead of Planetary Health Report Card India. So this is a global effort, and we can really hear from her about how this has been going on in a completely different context. Next, we have Melvin Otieno, who is an environmental scientist with an MSc from the University of Eldoret in Kenya. She's also a next generation fellow at the Planetary Health Alliance and is a founder of the Planetary Health Alliance East African Hub. And then lastly, we have Natasha Sood, who is also a fourth-year medical student from Penn State College of Medicine. She is a co-founder of the Medical Students for a Sustainable Future, as well as founder of an incredible resource for anyone interested in planetary health education, the Climate Resources for Health Education Project. So with that, I'm gonna go ahead and start us off just by giving you all a little bit of a background on why we're here. So, we often get the question, what does health have to do with climate change? And we would say climate change is first and foremost a health issue. Often it's discussed in an environmental context, but we really think about it as the impacts of climate change are health-based, and really there's a myriad of them. So, think about working in a clinic or a hospital or an emergency room with children coming in with asthma attacks, with your family members coming in with heart attacks, and after a wildfire, extreme weather events, disasters, thinking about water security, drought, and all of the health impacts of that when it comes to maternal and child health. Also thinking about the mental health impacts and how we really are still learning what they are and how to manage them. So why we are thinking about medical education as really a form of climate action, as we think about us as health professionals being on the front lines of managing the climate impacts and not feeling prepared to manage those impacts because it's not being addressed in our education system. And so it's not just medical doctors, it's also nurses, psychologists, social workers, every single member of the healthcare team. With that, we have had some success at our institution at the University of Colorado, and a lot of that has to do with what has been going on at a grassroots level with student organizations around the country and around the globe. So I'm going to hand it over to Terry to talk a little bit about what our experience has been creating a climate and health program and lots of programmatic options for health professionals to really become leaders in this space?
Thank you, Bar. Happy to be your partner in crime. You asked me to be here to perhaps discuss about a success in health, education, and climate, and I think I'll qualify that and say that perhaps what I'll review will be more of a successful response so far. I think we all know that climate change is a rapidly evolving space with rapidly evolving challenges, and I think we need to be nimble and successful in responding to those challenges in the years ahead. In that, I think that'll give me a segue to talk about, I guess, my three main points I'd like anybody listening here who's interested in this space to remember and take home. And if you don't remember anything else, focus on these items, and they will be perhaps waypoints for you as you think about crafting your career or leaning into this space in education with climate change. And these waypoints are conviction, connection, and also iteration. And so those three things, just be mindful of, and I'll go through them a little bit here in our example, but I think they'll be salient and pertinent to some of the other presentations you'll see here coming up. So conviction, I kind of feel like I'm speaking to the choir here in this setting at COP, but certainly that's a common thing we feel in a shared journey. I think it's useful to speak a little bit about one of our other heroes, Ed Maybach, who was one of our chief educators in our last course, and his framework for the 5 truths of climate change to help discuss a little bit how we get into the action phase with this work. And so certainly it's real, right? And it's caused by us. And everybody here believes it's true in science, and the experts believe it's true. And we know it's bad, and there's hope. And I think the reason to bring those up is I think that the key crux in those points and in that journey is how do we get from point 4 to point 5 and go from knowing it's bad, which is a lot of the data that we share, and we're trying to educate, but then move into hope and action with that. And I think that's where the first key benefit of approaching people that actually work in healthcare is, and that is it's easy to get mired in the abstractions of a lot of the sobering statistics that we're taught to share to some degree, right? So 7 million air pollution attributable premature deaths in the world annually. A third of Pakistan underwater, right? Those are sobering and sad, but they're abstractions. It's hard to really feel it, but as a clinician, and once you start practicing as a nurse, a doctor, a social worker, speaking with someone who's dealing with the mental health impacts of being displaced, like those impacts are very salient and they're very personal, and they hit you in a deep, resonant way that kind of calls out this imperative to act. And I will say that in my experience as a clinician, with examples, I mean, treating recently displaced refugees from rising sea levels in Bangladesh and Calcutta slums affected by dengue, or evacuating my own hospital during a wildfire as DC-10s drop retardant on the ambulance bay, are certainly very informative and lead us wanting to go into action. So how do we get to that action? I think one myth we need to discredit here is that you need to have hope before action, and I think that's what demonstrates what I'll get into here next. I believe it was David Orr that said that hope is, it's a verb, right? It's actually an action. Hope is action with its sleeves rolled up. And that's what our really our leader, and Jay Lemry, our chair at the Climate and Health Program, I think that's what he saw in an opportunity. So over a decade ago, Jay and I had met through Wilderness Environmental Medicine Connections. That's how the community started, at least for me, and realized, and I think Jay realized, that there was a lack of connection to planetary health concerns in environmental medicine. And so he moved from similar convictions that I had to thinking about his connections. And he had connections both academically, to collaborate with individuals at CDC and other centers to write a textbook on climate change and human health, from science to the actual clinical practice, in 2015. And then he thought about, in an academic center at the University of Colorado, what kind of a structure can I utilize to train somebody else? Well, there's postgraduate fellowship positions after you finish a training in an emergency medicine specialty, examples being toxicology or emergency medical services. Perhaps we should do a specialty in climate and health science policy. And that's what they did a couple years later, and struck gold with C.C. Sorensen as the first fellow who quickly accelerated the field with some successes, most notably something that made us realize proof and concept, our role and our power as advocates with their landmark paper in 2018 in New England Journal of Medicine exposing the true mortality impact of Hurricane Maria, which got a lot of capture in the press and realized and was a proof and concept that we have a role in policy as well. Then a further iterative process from there, and rolling from there and realizing, oh, we're only training one person a year in this construct that pre-exists. How can we expand? Chance encounter, connection with another individual, and Jenny Rankin of the Climate Health Fellowship, to be able to force amplify and develop a national policy fellowship where we could have remotely other health specialties engage, not just being emergency physicians, but now neurologists, family practice physicians, neurosurgeons, learning how to and partner with national agencies, engage with them moving forward. And then the final piece in the iterative process, of course, was thinking about me and my peers. What about the people that are actually working, that are in clinical practice? How do you get them into the space? They can't sacrifice a full year to be in this space. How do you help them learn some facility and fluency in this space? How do we train them to be advocates that can move policy forward? And the construct there was another somewhat pre-existing structure and market, and that is the continuing medical education market. In the United States, after you get specialized, you have to maintain your clinical practice through acquiring continuing medical education credits, and we figured, well, perhaps there's a market there. And informed by some of the great work, like from Carly right next to me, demonstrating that there was a demand in the medical education arena that we needed fluency from clinical leaders that were ahead, that were working as their attendings, and there's supervisors. And yet, when I asked my peers, and I even thought about myself, we weren't really ready to raise our hand to say we were feeling prepared to do that, and so we needed more professional training. And so we crafted the diploma in climate medicine, and I'll try to finish up to stay hopefully on time here. I think the success with that is really underappreciating the market that was out there. I mean, I think we saw a needs assessment that Carly will get in here, also something that came out in a health affairs paper, that there was probably a market to train physicians in this space. But we launched just this last year. We were hoping in our first cohort of diplomas we'd maybe have 10. We quickly capped at our 20, and we have 80, now 120, 130 people that are interested, and now our part of our iterative process and challenges is how we scale that forward. And as Bar and I were talking last night, actually, how do we scale that to make it more accessible out of the connections that we have at the university? So I think I'll pause there out of respect and get around to the other speakers.
Yeah, so thanks, Terry. That was a great sort of summary of what our experience has been at our particular institution. I will say now I am a faculty member in a department, in an academic medicine department, and you know, the partnerships that all of us in climate and health who are sort of in a faculty position have made with students and learners, residents, you know, other fellows, that sort of thing, they have actually been crucial to this success. And so I want to move on and sort of let Carly describe her amazing project, which is called the Planetary Health Report Card, and how that came to be and sort of what lessons we've learned on their approach to really engaging research and advocacy as a combination effort, essentially. Go ahead.
Thanks, Bar, and thanks, Terry, and thanks to the Climate Education Hub for having us. I was at the Children and Youth Pavilion yesterday, and they shared this African proverb, youth can move fast, but the older generation knows the way. And so to your point, that partnership between youth and the older generation can be so powerful, and I'm lucky to work with both of you guiding my way. So as Bar mentioned, I am a medical student in San Francisco and the founder of the Planetary Health Report Card Initiative, which is a student-led, metric-based initiative to inspire planetary health engagement in health professional schools around the world. And one thing we learn when communicating climate change and health, and really communicating anything at all, is that numbers numb, but stories stick. So I'm gonna tell you a story about how this initiative came to be. So I started medical school in the fall of 2018, and that fall there were wildfires raging across Northern California, and the city took on this eerie dusk color, pictures making international news. And even though we were ironically in our respiratory health block at the time, and hospital admissions all across the city were spiking, with many in the city, especially the most marginalized who couldn't escape the smoky air, feeling the health effects, there was no mention of the health consequences of climate change or even air pollution in our medical school curriculum. And it felt like a complete disconnect between what was so obviously going on in the outside world and what we were learning inside the classroom. And so, motivated to address that disconnect, some classmates and I started asking ourselves, well, I'm seeing that maybe we can't hear. Okay, we're good? Great. Motivated to address that disconnect, I worked with some classmates to start asking, well, what would an ideal medical school curriculum that addresses climate change and health look like? And beyond just curriculum, what would a research agenda look like? What would community engagement practices look like? What would sustainability look like? And one thing we've seen at COP, and really the climate movement at large, is that it's easy for institutions to make vague commitments surrounding climate change and health, but what are the tangibles? What are the metrics? Clearly, I'm a data person. So with the help of experts around the world, we devised dozens of metrics across 5 different categories: so curriculum, research, community outreach and advocacy, support for student-led initiatives, and then campus sustainability. And at each school, we constructed student-led, faculty-mentored teams, to your point about the partnership, that could fill out the report card, and as they went, identify opportunities for growth, hopefully then working with their administrations to actualize that growth. And we gather the results from all of the participating schools and all the participating countries, and put them together in a report that's published on Earth Day, fitting that we're in the Earth Day pavilion here, and then try and leverage that ranking and that report for change. And this project started off as just a pilot at 2 schools in North America, but quickly has grown to encompass over 100 medical schools at 15 countries around the world. And what's super exciting is that recently we've launched into different health professions as well. So last year we published pilots in nursing schools and pharmacy schools, and then this year we're working on dentistry and physiotherapy as well. And what's also great is that we see that for schools that have participated for multiple years, there is improvement every single year. So once they've identified these very discrete gaps, they're able to solutions follow in quick succession. And I think that also speaks to the motivation of students and young people to take action in this space. But often it's hard when you're coming into a program. You don't really know the landscape of your medical school to take action in a meaningful way. And so I think the report card can be a good entry point for that. And I imagine that many of the people in the audience or many of the people watching this are not health professionals, but I think this is a model that can be applied in a lot of other contexts. And we didn't invent a needs assessment here. A needs assessment is used throughout education, often immersed in educational theory. But I think you need the needs assessment paired with advocacy. And so our model is a little bit different from traditional educational theory needs assessment. We don't only have the science-based evaluation metrics, but we have public-facing rankings with a visually appealing report. We have a global student community that's constantly cross-pollinating ideas. And then we have crowdsourced solutions, and Natasha will speak a little bit to that later. And we're not the only ones who've adapted this sort of model. In the US, there is a law student, law firm climate change scorecard that I've learned a lot from, and has really highlighted the ways that law firms are funding the fossil fuel industry and guiding people and where they might want to apply for jobs post-graduation. There are grading systems for campus sustainability. And actually, this report card was inspired by a similar report card evaluating racial justice. So this is a model that works, and I hope that you're thinking about how this model could be applied to your setting, especially youth, because we've spoken to the power of student leadership in this space. And looking forward to hearing from Anandita about how this model has been applied in India with some solutions that have followed from identifying the gaps, and then also from Natasha about how some of the gaps identified in the report card can then be paired with solutions in the Climate Resources for Health Education initiative that she founded in sort of a 1-2 punch of problem solution.
All right, thank you so much, Carly. I think this is a great segue to, so we've heard a little bit about how this project came to be, but implementing a project like the Planetary Health Report Card is going to be different in every context, and so I think I'm really looking forward to hearing from you, Anandita. I'm not sure if we can get you on Zoom, and if you want to take it away.
Yeah, hi. Am I audible? Okay. So yeah, I am. Are you able to hear me? Okay. I am Dr. Anandita Patnaik, and I am the regional lead for Planetary Health Report Card for India. And I'll tell you my story of how I got into the climate change and health space. So, at the beginning of the COVID-19 pandemic, I took an online course on the health impacts of climate change. And as a recent medical graduate from India, I was surprised at how little I knew about these health impacts of climate change. Speaking with my peers and juniors, seniors, I realized I was not alone. And most medical students and doctors in India did not know much about climate medicine. Now, why is it important for healthcare professionals to be aware of the health impacts of climate change? Well, South Asia is a highly climate vulnerable region and will continue to disproportionately bear the brunt of the different catastrophic events, as evidenced by the recent floods in Pakistan. And there is a change of epidemiology of infectious diseases as the global temperature rises and precipitation pattern changes, and with the different extreme weather events occurring. For example, in the USA, a case reported in 2018 mystified doctors, and after a lot of investigations and brainstorming, it was diagnosed as a case of West Nile virus, a potentially fatal disease that can affect the brain, and a case that the doctors had never seen before. It is transmitted by mosquitoes, and mosquito borne diseases are primarily seen in the tropical region. But as the global temperature increases, the spread of such diseases to colder regions and higher altitudes is also increasing. For example, in India, the Zika virus, another mosquito borne infection, is now transmitted in non endemic regions in higher altitudes, such as the Himalayas. Non endemic basically means that where the disease is not is uncommon and the population lacks immunity against them, and this can result in a severe manifestation of diseases. Thus, healthcare professionals need to be equipped with the knowledge and skills to effectively diagnose and manage such climate change linked diseases without wasting precious life saving minutes. Also, simultaneously, health systems need to be climate resilient and include which includes intensive surveillance to detect and prevent any such outbreaks, but also to reduce the healthcare carbon footprint. So, recently I got the opportunity to officially assess the climate preparedness of medical colleges in India through the Planetary Health Report Card project. The healthcare system in India is a mix of private and publicly funded health systems. So, in the pilot project, we had one private medical college, which was St. John's Medical College from Bangalore, and one publicly funded medical college, which was SCB Medical College from Cuttack. The main challenge in implementing the Planetary Health Project in the Indian context was explaining to the administration and the faculty what the project is all about and what climate change has to do with health and what is being evaluated here. We looked at the five metrics as Carly has already mentioned, that is curriculum research, community outreach, support for student-led initiatives, and campus sustainability at both the medical colleges. St. John's Medical College from Bangalore scored an overall of 64%, while SCB Medical College scored an overall 57%. The main difference between the two was that St. John's Medical College had a more evenly distributed score across the 5 domains, while SCB Medical College from Cuttack scored mainly on the medical curriculum with a score of over 62%, but scored less than 19% in research, community outreach, and student led initiatives. The latter kind of reflects the sentiments of the Indian education system and society at large, where the curriculum is more stressed on, but the other vital aspects of education take a backseat. So there's a huge potential to increase planetary health related research and community outreach activities to increase the awareness about the health impacts of climate change amongst the general public. I would also like to highlight some examples of sustainable practices from both of these medical colleges. For example, St. John's Medical College meets 90% of its energy demands through renewable wind energy and encourages active travel, that is, the use of bicycles and walking within the campus, while SCB Medical College uses battery operated vehicles to transport patients. However, it is evident that there is a huge gap in the Indian medical education currently, and there is an urgent need to provide a more holistic medical education with equal emphasis on all the 5 domains on which they were assessed. And this can help the medical colleges to become carbon neutral, sustainable, and well prepared to deal with the climate crisis. And on a final note, I would like to say that it has been quite motivating to see that just within a few months of its inception, the Planetary Health Report Card in India has helped to start a dialogue around planetary health for health professionals. For example, St. John's Medical College recently hosted a lecture and is also planning a series of lectures over the next few months on planetary health for the medical students. We hope this encourages other medical colleges and national medical education bodies in India and other climate vulnerable countries to reform the medical curriculum to include climate change and health and ensure that healthcare professionals are upskilled to deal with the climate crisis in an efficient and adequate manner. Thank you.
You can go ahead, Anandita.
Sorry. Yeah.
Were you wrapping
up? Yeah, I'm done. Thank you.
Yeah, okay. Sorry, it's been some of the technical glitches. All right, so thank you so much for that sort of description of how everything has been going, in India with the Planetary Health Report Card. It sounds like it's gaining some momentum and it has led already to some change and hopefully more in the next year. I also want to switch gears and turn our attention to Melvin, who has this amazing project in East Africa where they're really tackling planetary health education at an even more grassroots level, it sounds like. So, Melvin, I'm going to hand it over to you.
Thank you so much. And I would just like to tell the audience about what planetary health really means to the East Africa and some of the practices we've done on the issues of engaging the community in planetary health education, especially from the medical students. So we all know that Africa is disproportionately affected by climate change, and it's the vulnerable region in the world. And this is due to lack of resources for adequate mitigation and adaptation. So we find out that in these settings, we find out that there are poor communities who are disproportionately affected by these climate change effects. And despite this reality, Africa contributes to the global initiatives and are committed to the climate change action. So in our scenario with the Planetary Health Eastern African Hub, which aims at stimulating regional community building and also providing education for transformative action, and also pushing forward for policy making, we see that there was need to engage more of education in the medical curriculum and also and also the public health curriculum. So we see with the planetary health concept, which is a new health paradigm concept. So it requires a new approach for the medical education based on the cross-cutting principles for the planetary health, which really has helped a lot in introducing planetary health education into different setups. So we see that planetary health and also the indigenous perspective and the core knowledge, values, and practices need to be incorporated into education for the sustainable healthcare. And the Global South can lead the way on incorporating this new approach in the medical education. So in terms of just highlighting as an example of in practice of how the Eastern African Hub has been able to engage or promote planetary health education and climate change education into the spaces, we last year collaborated with an online, an organization called Daktari Online, which is an Africa leading organization on medical resource center. So with them, we actually were focusing really more on engaging the community or the medical practitioners to discussions on the topics of planetary health and also climate change adaptation and climate change into clinical practices. And in the process, we are honored to have like around 1,700 registrants, participants who attended these courses, and we find out that around 700 were from medical practitioners who were able to get their credits, which was really interesting. And at the same time, we were trying to leverage the global networks that we have so that they could learn from people from the global north and so on how they're tackling these issues and so on. So it was really interesting that the community, as in the student community, were really positive on being a part of the change and embedding planetary health as one of the courses into their curriculum. Apart from that, we also were focusing also with doing a pilot study in other institutions here in East Africa, especially from public health also. And right now we have some institutions like University of Eldoret and some institution in Zambia, which have embedded planetary health as a unit and also as an elective course, which is really promising. And at the moment, we are also focusing on a 4-year project called SOPHIA, Strengthening One Health and Planetary Health in East Africa. And as part of this project, we are really looking into education, research and collaboration, community outreach, and also student engagement. So this year, actually, we've been able to do a lot more on focusing on digital lecture series also. And also we've been having summer school programs in Wurzburg, where the students were able, both medical students and public health students were able to exchange case studies, ideas on how they could use their knowledge into action. So they came up with a lot more of projects that will tackle climate change. And it was really exciting to see how this brainstorm of ideas among students from the global north and global south was really impactful. And in the process also, I'm currently in Tanzania whereby we were also having a conference on non-communicable diseases. At the same time, we are trying to integrate as in South-to-South collaboration. So we had students from Kenya and Tanzania also sharing their perspectives about planetary health and how they could move forward in tackling these issues. At the same time, we have also leadership opportunities like Planetary Health Campus Ambassador Program, whereby we enable the students to take lead into coming up with projects that they could do with the grassroots communities, like so that they could work closely with the community, because we cannot work in silos at academic level, but we need also to involve the communities on board and also policymakers. So through that student exchange program, we've seen more positive output out of this. And for this SOPHIA project, we are aiming at coming up, as in we are now developing a planetary health toolbox, whereby we will be disseminating resources to all institutions in the Eastern Africa regions. So that's our target as per now. And also we are coming out with a scientific advisory board who will be helping us in sharing ideas on how we could strengthen the research networks within the region so that the student community can strengthen their work, and also we can tackle these climate change issues together. So with that, thank you so much for listening. And I'm looking forward to any questions from the audience.
Thank you so much. That is very encouraging to hear about some of the successes that you've had. just checking. I'm going to also move on to Natasha, who she is, as I said, co-founder of Medical Students for a Sustainable Future and also founder of this amazing project called Climate Resources for Health Education, which really has the potential to have global impact and change the game in planetary health education, because it's really the one of the best solutions I've seen in this space. So I'm going to let you take it all away, Natasha.
Thank you, Bar. Thank you for the introduction and for your kind words. It's really a pleasure to be here this morning and afternoon. So as we've heard from our colleagues today, health professionals really do play a very critical role in responding to the climate crisis. But in order to effectively anticipate and effectively care for our patients, in the context of our changing planet, we really need the vocabulary and the training to identify and address these issues. So that's where we created the Climate Resources for Health Education Initiative. And this is a free, publicly accessible, evidence-based repository of climate change and health learning objectives, slide decks, and case studies that can be incorporated into health curricula to address the barriers facing climate and health integration, which we've heard about from the panelists today. And a lot of these barriers have been identified by the Planetary Health Report Card, the Global Consortium on Climate and Health Education, and the International Federation of Medical Students Association. And through their work, we really found that much of the reason why climate change wasn't being incorporated into education was often due to the lack of available staff time or funding to support curriculum development. And although students and educators were interested, they felt like they didn't necessarily have the expertise to teach the concepts in their classrooms. We also know that many individuals at many institutions are working to develop climate and health resources. So we wanted to create a centralized hub of education materials so that individuals did not have to reinvent the wheel at each of their respective institutions from a curricular development standpoint. So the Climate Resources for Health Education initiative is very much a scalable program in which we really do the legwork and provide educators with a modular repository of core learning objectives and core materials that can then be adapted and customized based on their institutional and region-specific needs, and very much integrated into diverse educational formats. So in order to do this, we created a pretty unique structure in which trainees and health professionals from around the world, again, going off of the partnership approach, could build these resources with us. We've had almost 400 individuals from over 20 countries and 150 healthcare institutions and organizations sign up to do this with us. And we assembled them into teams of up to 3 trainees and 1 practicing health professional who serves as an advisor, so to speak. And they co-create a case study or slide deck on one of our 100 very carefully vetted climate change and health topics. And these topics range from organ systems, so content in cardiology and respiratory, to dermatology, as well as health system science, which really explores sustainable health systems and social inequities as drivers of climate change. And so for each team, we provide them with templates and user guides to guide their content development. And once they've created the materials, they are reviewed by the CRHE team for standardization, as well as experts in the climate change and health field for content accuracy and evidence base. And in the first year of our program, we've published 30 high impact cases and slide decks on our website. And they've all been mapped to PHRC metrics, as Carly was mentioning earlier. And each slide deck and case study is accompanied by speaker notes and facilitator guides. And these include discussion prompts, answers to learning objectives, and really help educators to use these seamlessly in a classroom setting. But I think one of the most exciting parts about it for me is that we've not only been able to develop climate change and health resources, but we've also been able to develop an opportunity for trainees to learn about curriculum development and very much dive deep into a climate change and health topic that they're passionate about. And then, of course, network with peers and mentors around the world, not just within the climate change and health space, but specifically within the specialty that they're interested in. And I will say, that our program success is very much dependent, entirely dependent on our partners. CRHE has been such a team effort. It's a collaboration between the Global Consortium for Climate and Health Education at Columbia, as well as Massachusetts General Hospital, Brigham Women's, UCSF, and Emory University School of Medicine. And as we enter year two, we know year two of the program, we know that the impacts of climate change on health and the health systems are very global and very complex. And certainly no one resource bank can address all the nuances that need to be conveyed in educational settings. So accompanying our resources, we've developed an implementation guide to help introduce educators to the CRHE resources and then help them tailor those resources to meet their local needs. So this will include steps on how to find faculty champions, how to bring this up to leadership at institutions, partner with trainees, and then of course link the materials to their existing curriculums. But I think there's also a couple other exciting opportunities as we continue to grow our program. We're building out a series of webinars that will be able to highlight best practices on implementing these resources. We want to make sure that these resources are integrated longitudinally across health education, not just in didactic sessions, but really bringing it into the clinical space to teach health professionals how to bring up these concepts with their patients and within the teams within which they're practicing. And then, of course, as Barb was mentioning, really develop region-specific content that can be adapted in a global setting and making sure that our resources are translated to meet the needs of learners around the world. And along that vein, as Carly was mentioning earlier, our response to climate change is very interdisciplinary. And so during year one, our pilot focused on medical education. But as we progress, we are now developing nuanced resources for nursing education, pharmacy education, and health equity education this year. And I think that this can be a powerful template to rapidly translate science into curriculum, no matter what educational topic you're focused on. But we certainly hope that CRHE is providing educators with resources to accelerate the incorporation of climate change into health curricula. And I think paired with the Planetary Health Report Card can offer a very data-driven and intentional way for health professionals to tackle climate change and health in the educational setting. And overall, I think it's really meant to empower health professionals to become change agents, innovators, critical thinkers, and champions from a very early standpoint in their education so that they can recognize and effectively address the impacts of climate change on health in their practice. So thank you very much, and I'll pass it back to you, Barb.
All right, thank you so much, Natasha. So I'm sure everyone's reeling a bit because you've heard about lots of projects and lots of tools that have had lots of success in the medical education space, at least. And so I just want to quickly kind of give a recap about what you all heard. We have the Planetary Health Report Card, which is a student and grassroots-led initiative to create a needs assessment as well as metrics by which healthcare education institutions can really measure themselves. They can get a baseline and figure out how to improve in planetary health education, not just in the curricular space, but also in the community engagement, advocacy, and research space, right? And then you have examples of how this report card is being implemented in the Indian context. We have an example from the African continent and East Africa specifically, about how planetary health education initiatives are being implemented on the ground with community health workers. And the really important thing to point out there is that it is important that planetary health education itself, the curriculum, the content, what it is actually defined by a diverse group of individuals that includes members from all regions. And then we have solutions, really helpful solutions that a lot of people do not have time and resources to work on at individual, institutions. But we have, again, a student-led, grassroots way in which essentially we're crowdsourcing the actual curricular material to educate not just students, but faculty, because faculty development is a really, really important piece of the puzzle. And that's probably, honestly, the rate-limiting step, actually, in this space. And then, we started off with an example of a medical school that's been able to embrace this and actualize this into programmatic development. We have a fellowship, we have a diploma. We're scaling this up at that academic space, in that, demonstrating its value and being able to create a lot of leaders in this space that are doing all sorts of things, from policy to research to advocacy. So hopefully that provides a good recap. I want to open it up to questions from the audience and go from there. Go ahead.
Okay, thank you. I am Bernice Dam from Liberia. Before coming here to this COP, this is my first COP. And I was asked by my boss, I work with the University of Liberia, and I was asked to join the delegation from Liberia to come here, and I was wondering about what am I going to do there, because I'm a physician. And I was passing yesterday, I saw the topic, and I developed interest in it, and I came. You did say that you're looking at ways of scaling up the training. I went on your website, and I saw registered now, something like that. I fill it in. But I just want to hear from you, what are some of the ways you are thinking about scaling up? It is limited to maybe the United States? Is it going outside of the United States? How do we access? Then with you to the planetary health report card, how do we make use of it? I also work with policy issues on community health workers, so I develop interest in that, and I just want to hear how these instruments can be used. Thank you.
Thank you for your question, and it's timely because Bar and I were having a little existential crisis last night talking about this exact thing. I think to be perfectly transparent, the imperative and the urgency is so there that we just needed to move forward. I spoke about this concept of how to get to hope, and hope is, it's a verb with the sleeves rolled up, and we just have to get started. In review of the literature and seeing some of the data that was being produced by the Planetary Health Report Card, we assumed there would be an audience, and we needed to fast track and launch something as soon as we can, and we needed to prove in concept that there was a community that was interested, in literally paying money, right, to continue their professional education. And we've been shocked by the level of interest. And in that, I think we've unfortunately did not think of the scale at the beginning and in catering to exactly like someone like yourself and bringing this into a larger global platform. We literally have some meetings that we very much need to dive into in the next month or two based on basically the engagement we've had in the healthcare community so far to figure out how we can make this more accessible. I will say that overwhelmingly, when we surveyed our last cohort just a few months ago, the value of the in-person time to create community, to help each other iterate ideas on projects that we think we have levers to lean into to make a difference in this space, whether it might be auditing our own home institution, or perhaps leaning into a policy sphere at our local constituencies at home. The cohort found that in-person time to be invaluable, and part of what we wanted to distinguish ourselves was some actionable exercises together so we could do that. How we can bring that to an international community, I think, adds a lot of complexity, cost, and environmental impact, frankly, right? To force people to travel that far, but we all talk to one another. We know each other. And I think what we'll find is we may adapt some of these excellent ideas and frameworks that Natasha and Cece have developed and think about how we might be able to collaborate for more online curriculum going forward to try to cater to individuals like you. But I'd be happy to get further ideas from you if you have any other thoughts afterwards. We can share contact. I'll probably pause there and then let you, Carly, address a little bit of the assessment. So.
Well, first of all, maybe need to Hello. Okay, great. I needed to be more patient. Not my strong suit. But first of all, we're so happy you're here. I think this is the whole purpose of COP, is to connect with people from all around the world. And we've noticed that the health community at COP is not, we're limited in number. And so it's great to meet another one of us. But to your question about how to bring the Planetary Health Report Card to Liberia or to different contexts, we are always looking to expand in new places. And we've talked with mentors over the last few years as the project has evolved about how loose to be in allowing the report card to be whatever people want it to be. And I think while we are so open to collaboration and iteration and letting it take on many forms, one core tenet is that it's student-led. So if there are students that you work with in Liberia, we would love to connect with them. And yeah, our website is phreportcard.org. You can reach out through us through there, and we can work on getting it deployed in your university.
Yeah, and I'll also just say, I think when we're talking about scaling up what we're doing at the University of Colorado and how to make it applicable to the global context, this is where, I mean, this is one of the reasons we try to collaborate in a place like COP. It's because we actually need to meet the planetary health experts in your context, because we are not experts of what's happening in the health system in your country, right? And, you know, as Melvin said, this might look different depending on the health system and the infrastructure that exists on the ground. The solution for managing air pollution, both in and out of the exam room, is not the same in New York City versus, you know, rural United States versus some other country. And that is just knowledge that we do not currently have, you know, quite frankly, on our faculty. But as we think about scaling this up, I think we really have to think about the global challenge while working on, you know, our regional context within the university itself. But yeah, I agree. I think we just had to make it happen and, you know, let the thing fly to start with.
The other thing to add that I didn't mention is in this effort to address the urgency and launch, I mean, in some ways, again, I mentioned again, remember, 3 principles, and one of them being kind of an iterative process. This is certainly part of that. Early on, over a year ago, I was very paralyzed that I need to get a full curricular roadmap laid out. I need to have all the core competencies, all the learning objectives laid out, and then we're going to plug and play for the next 2 years. We didn't have time. The demand was there, the ask was there from our medical student colleagues and medical schools. I think it is very much Bar and I's vision to collaborate with everybody that's here, frankly, and we do need, and it is our duty for the global community to publish what the components of a curriculum like this look like, right? And the depth and degree you go into it may be most comprehensive, like at the fellowship level that our current fellows are that are engaged in with national policy and federal agencies, and then down to the diploma, and down to medical student curricular level, and even, you know, health sciences undergraduate education too. So, I mean, that is certainly something we're committed to in the future as well.
Coming close to the end of our session, so I just also want to point out, you know, highlight some projects that are growing, and I think you heard from both Carly, Anandita, and Melvin, as well as Natasha, about how the projects that they're engaged with are growing. So we know that Planetary Health Report Card will continue to expand, maybe into other health sectors, maybe into other professions, you know, that sort of thing. We know that there are lots of exciting projects for engagement with community health workers on the ground in the East African setting. We know that the CRIC, which is this repository of curricular content, that is ever expanding. You know, I've certainly, you know, been one of the faculty. I think all of us have worked on the curriculum for that particular project. I see a couple people in the audience who've also worked on it. And, you know, I want to, again, mention this partnership between people who are students and learners, because the scale at which that they have been able to do this with, quite frankly, very little financial resources is like, it's mind-blowing, right? And so there is a group called Youngo, and it's their health working group. So this is a group of health-focused folks in the youth and children's constituency working on this sort of thing, engaging with other medical student organizations, and they've really been able to, push this agenda forward. We have, folks from the traditional complementary and alternative medicine space. So this app over here, the Govardhan app, is it's a way to crowdsource knowledge about traditional plants all over the world using the power of social media and that sort of thing. And then, again, the partnerships with a few academic institutions as well as medical societies. So in the US, we have a Medical Society Consortium for Climate Change. So this is a group of initially physicians, public health workers, and climate scientists who sort of came together and said, let's get all the medical societies in the US to really, join together and focus on this issue and, again, crowdsource together. The Columbia program, the Global Consortium of Climate Change and Health Education, this is an open source repository of climate and health education resources that people are using all over the world. And that is a great entry point and a great way to really increase access on the global scale. And then, again, we've talked a little bit about our diploma and what we're doing, but there are other programs around the country that are really starting to lead in this space. And so I just want to, make sure that we highlight that and where this can possibly grow. Looking at the time, I think maybe I can take one more question. Does anyone else have one? Okay.
Thank you, and thank you for your time. My name's Tommy. I'm an undergrad student at Indiana University, and I just wanted to ask, like you said, the health representation here is a little more limited than maybe in other spheres. What are some pieces of like the health climate intersection that you think are missing and you'd like to see more in future, like COP negotiations or just other forums of this size?
Yeah, I'm wondering if any of our virtual participants have any thoughts on that particular question, but I'll kind of start by saying, I think just when someone closes their eyes and thinks climate change, we would hope that people see the picture of people using inhalers. We would hope that people are looking at, pregnancy outcomes, childhood health, mental health. That is what we think of as a climate issue. And so when I think about what needs to happen, a lot of our fellows, a lot of our trainees, a lot of the health professionals who have become engaged with this space and become climate change and planetary health informed, their measure of success in climate action is rooted in health indicators, right? And so when you talk about what are the health benefits of any form of climate action, what are the health harms of any form of climate action, all of a sudden solutions just seem to fall into place, right? When you're actually accounting for the true cost of inaction or action. And so I think that's really the goal, is that we are using health as an indicator of progress or failure when we're talking about climate change. Wondering if anyone, virtually has anything else to add?
I would just like to say that, very simply put, what is good for the planet is good for the human health as well. So it's a two-way street. So, fossil fuels are not good for the planet, and active travel, like walking or cycling, is good for the planet as well as the human health. So it's always like a bi-directional link is there. So if health is put into the core or center of the climate action agenda, then a lot of the problems would be easily solved.
I'm going to just
Thank you.
quickly ask Melvine one last question, because we do have her here, and I think it's important to highlight some of the work she's doing. Melvine, can you tell us a little bit more about, what's next for the project that you're working on?
Thank you so much for the project that you're working on. The next steps are we're planning to organize more of consultative meetings with the institutions in Africa, and especially also want to share the educational materials and best practices examples with these institutions so that at least we have the case studies and also the curriculum reviewed in these institutions. And they're also kind of wanting to integrate more of research networks so that we have regional research networks working together rather than us working like in silos the way previously most institutions are doing. So we are encouraging, like let's say in Kenya, for instance, if University of Eldoret could partner with University of Nairobi in research, also like within the country and also at national level and also in the regional level. So, and then moving forward, we are also having organizing like more of summer school programs for the students and also inviting people from the global north to come to the global south, like to see best practices of how we are doing our work locally so that we could do projects together. So that's the main thing. And aside from that, we just look forward to more collaborations and partnering in these spaces. Thank you very much.
All right, so I think that's a great place to end. Hopefully you guys have some good examples that you can take back to your home institutions and see how this applies to your own education sector or even just your own profession. Thank you all so much for having us. Thank you to Earth Day and the Climate Education Hub. It's been great to share our experience here.